In this video lecture, we are going to take a look at more brain disorders, including Tourette Syndrome, Narcolepsy, Parkinson's disease, Huntington disease, migraines, and headaches. So the first disorder we are going to discuss in this video lecture is a tic disorder known as Tourette Syndrome. So Tourette Syndrome is characterized by episodes of involuntary, rapid, repetitive movements of individual muscle groups. They occur with very varying frequency and can be associated with involuntary, repetitive vocal sounds, words, or phrases. Many medical personnel think that the tics, whether physical or verbal, are genetic, but they aren't actually sure of that. And there's no cure for Tourette syndrome, but the symptoms can be treatable with medication. So you might see people with Tourette syndrome just very randomly making these very quick movements with their body or shouting out different things that really kind of make no sense in context. That is a tic. So if you have these tics, you are known to have this Tourette syndrome. Narcolepsy is the next disorder that we are going to talk about, and this is one of your words. It's a condition with frequent incidents of sudden and involuntary deep sleep. So you really just fall asleep randomly and you go into a deep sleep. This disorder is caused by the brain's inability to regulate the sleep-wake cycle. So individuals with narcolepsy will usually fall asleep during the day for anywhere from a few seconds up to an hour at a time. It's associated with something called cataplexy, which is another one of your words. Cataplexy is the sudden loss of muscle tone with brief episodes of paralysis. So really, if you look at the image here, usually there's some sort of like an emotional trigger, and then cataplexy takes effect, which causes your muscles to basically lose their muscle tone, which makes you kind of collapse to the floor. You kind of become paralyzed, and you will go into a really deep sleep. Usually there's very vivid hallucinations that are associated with cataplexy, and there is no cure for narcolepsy, but it can be treated with different medical stimulants. The next disorder we are going to talk about in this video lecture is Parkinson's disease. I've seen it as Parkinson's disease or Parkinson's disease. I'm not entirely sure which one is correct, but this is a disease that's caused by the degeneration of neurons that produce dopamine. About 10% of the cases of Parkinson's are genetic, but the other 90% are not. And that's a little worrying. We don't really understand how it comes about. There's no really predictors of it. Even if you have the genes for Parkinson's, it doesn't mean that you are going to get it. One of the very first symptoms of Parkinson's is usually a tremor, and it's usually in one of your hands. And doctors call that first tremor, it's like a pill rolling tremor, where you kind of roll your pointer finger and your thumb together as if you were rolling something between them. And that's usually the first tremor that arises. And it's usually when the individual is at rest. Usually when you're moving, like if you go for a walk, the tremors tend to kind of dull down a little bit. So if an individual is at rest and they tend to start doing that tremor, that's a sign that they might have that Parkinson's disease coming on. They might also experience some stiffness in their muscles, slowness in movement. Loss of balance is a really concerning symptom because you can fall over and hit your head. You might notice that the individual might have a weaker voice than usual. There's a lack of facial expression that's associated with Parkinson's disease, so maybe it's really hard to read their emotions. They might drool more because they, again, can't really control their muscles as much in their face. And then they might also have like a loss of smell that is associated with Parkinson's. There are a lot of medications that these patients can take that'll help with the symptoms, especially early on with Parkinson's. Exercise has been proven to help. Obviously, it prevents the tremors or makes them lessen. And it's been proven to slow the progression of the disease itself. So exercise is really proven to help with Parkinson's. But as the disease progresses, an individual could develop other symptoms like hallucinations. They might have memory issues, difficulty speaking, a big loss of balance, and also problems swallowing. And the last two are very concerning. So loss of balance, like I said, they could fall and hit their heads or get injured. And then issues with swallowing brings about the issue of choking. So there's a lot of different aspects to Parkinson's, but again, that pill rolling tremor between the pointer finger and thumb is usually the first sign. Huntington disease is the next disorder I'm going to talk about, and this is a genetic disorder. It's a neurodegenerative disease, and it is fatal. There is no cure for it. You eventually die from Huntington. The disease begins usually to show symptoms between the ages of 30 and 50. And you usually notice some sort of mild personality changes within that time, because if you look at the picture on the screen, Huntington disease is neurodegenerative, which means that your neurons are breaking down, which means that your brain is basically dying and you start to have these holes. And obviously your personality is held in your brain. So that's usually the first sign. This affects about every 1 in 10,000 people. So it's not rare, but it's also not rare, if that makes any sense. The disease is hereditary, and if I can take a little sidetrack talking about the genetics of this, it is autosomal dominant. And if you know anything about genetics, you know that if a trait is dominant, it's usually not difficult to pass it on to future generations, because you can either have 2 dominant alleles or just 1 dominant allele, and you could have Huntington disease. So scientists have actually understood the exact gene that causes this disease for about 27 years now. So since 1993, we've understood the cause of it. It's very specific. On your 4th chromosome, there's a Huntington gene, and this gene contains a series of repeat codons. So it's just the base is CAG repeated. And depending on how many of those repeats you have, it's going to determine how likely you are to develop Huntington disease. So the gene on your 4th chromosome is used to create a protein called Huntington protein. If you have too many of those CAG repeats, it results in a toxic form of this protein being produced in your cells. The toxic form of the protein is going to go on to damage the normal neuron function in your brain. So it's going to cause early death of neurons. And it's usually in the areas of the brain that are responsible for cognition, personality, movement, and some of the symptoms of the disease are obviously associated with that. So personality changes, you might see involuntary, irregular, jerky movements, you might see some muscle weakness. A lot of people with Huntington disease eventually end up in wheelchairs, and later in the stages of Huntington, you can end up getting dementia. And again, there's no treatment, there's no cure, and it's fatal. So eventually, individuals die from this. Syncope is another one of your words, and it's just a fancy term or the medical term for fainting or passing out. So the way you say it is syncope. This is usually caused by a temporary loss of consciousness and posture, which causes your body to fall to the floor, right? Your muscles are naturally usually flexed to keep you upright and keep your posture really nice. When that muscle tone goes away because you've lost consciousness, your body collapses to the floor. It's kind of like what happens during cataplexy. So it's usually caused by something called hypotension, which is low blood pressure, and that brings about hypoxia, which is that low oxygen supply to the brain. And when the brain doesn't get its oxygen that it needs, it's going to kind of react as a fight or flight kind of reaction, and it's going to cause you to obviously lose consciousness. The biggest thing with syncope is making sure that the individual that is fainting does not hit their head as they fall. Otherwise, fainting or passing out is not fatal. It's usually you wake up within a couple of seconds or a couple of minutes. And if you do see someone who is fainted or passed out, usually putting them in this reclined recovery position is best. Migraines, something that I am very well versed in. These are going to be migraines. Something that I am very well versed in are paroxysmal severe headaches that are usually confined to one side of the head. The word paroxysmal is not one of your words, but it's not a common word that we hear every day. So let's define that for you. So paroxysmal is referring to a sudden attack or spasm. So this means that migraines, if you've ever had one, you know, come on fairly quickly. So when an individual has a migraine, they usually have really intense throbbing or like a pulsating pain in one area of their head, which is commonly associated then with nausea and vomiting. Some individuals get something called an aura before the onset of their migraine. I had my first one a couple months ago, and it's really just a visual disturbance, usually of like flashing lights of some sort, and can even get as bad as like a temporary loss in vision altogether. Auras are also known to happen prior to seizures in epileptic patients, and usually auras are more common in individuals who have a family history of migraines. They also come about when you are more stressed than other times. Like I think I got my first aura because I was super stressed when I got that migraine, and they also happen more often in women than men. The causes of auras aren't really understood, but scientists think that it's due to some sort of an electrical signal wave that moves across your visual cortex of your brain and causes like visual hallucinations. So the image here is probably the best computer image that I could find that it kind of shows you what an aura looks like. When I got mine, like I see like lines or zigzags of like flashing lights, so I couldn't even read a line of text because it would block it from me. They're kind of scary when you don't know, like you've never had one before. Headaches are kind of a step down from migraines. They're less painful, but just as annoying as migraines. A vast majority of headaches are simply caused by dehydration. When our bodies become dehydrated, which means that we don't have enough water, the brain can temporarily actually shrink from the fluid loss, which causes your brain to pull away from the skull, causing pain. Obviously, it sounds painful, and that results in a headache. Once you rehydrate, so usually when I know someone who has a headache, I tell them to drink a glass or two of water, and their headache usually goes away because their brain is plumping back up and returns to its normal state, thus relieving the headache. Most dehydration headaches are dull, but severe dehydration can cause migraines. And some studies have been done to look at how much water loss is needed to produce dehydration headaches. I haven't really seen the same thing said over multiple experiments and research studies, but one study found that 2 cups of water relieved the headache within a half hour, and another found that drinking 3 cups of water brought relief after 1 to 3 hours. So really, to be safe, drink 3 cups of water and your headache should go away if it's due to dehydration. So if we learn anything from this entire lecture, stay hydrated, my friends. In their chronic form, so meaning if you get headaches on a regular basis, those can be classified into 3 different categories. So the first is called vascular headaches. These headaches are caused by blood vessels in the brain becoming dilated and distended, or in other terms, becoming expanded, or they're bulging, so they're becoming bigger, which produces a throbbing pain in our heads. Migraines are the most common form of vascular headaches, but cluster headaches, which are absolutely terrible, so I've heard. They are episodes of super intense pain, usually behind one of your eyes, and they are associated with hypertension or high blood pressure. I have watched my share of YouTube videos on cluster headaches, and my boyfriend in college used to get them all the time, and they all kind of describe them as if someone is grabbing the inside of your face, right behind your eye, and literally pulling it out of your skull. The videos I've watched on cluster headaches that actually show people getting them, they look terrifying. So they scare me. You should maybe look up a video if you want to understand what I'm talking about. The second category is muscular or tension headaches. I get these a lot if I've been sitting all day. These headaches are due to tight muscles, usually in your face and neck. So usually like a simple stretch of the neck muscles or like a relaxation of the facial muscles in general relieves the pain really quickly. The third and last type of headache is inflammatory headaches, and these are headaches that are due or caused by other diseases in your body. So usually diseases in the meninges, which we'll talk about in another video, your sinuses. If you have diseases with your teeth or ears, they can cause headaches due to inflammation with the disease. And that is the end of video lecture number 2.